Good morning. I hope everybody's legs are still hanging in there at this point. I'm Dr. Corso, Steve Corso. I'm a medical oncologist here at Gibbs Cancer Center. I've been here for almost 15 and a half years and have been caring for majority of my years breast cancer patients. It's a challenging disease and one that I'm hoping this event that you all are engaged in over the last 12 hours will help the many women in the upstate who unfortunately find themselves with breast cancer. It is a disease that affects probably most people's family at some point. Even those who don't have family history unfortunately find themselves developing breast cancer. And unfortunately for most women, they can't necessarily do anything that will prevent it from occurring. However, we are getting better at identifying women who are high risk. We have a high-risk clinic in the breast center that will help women who have risk factors that put them at greater risk than the average woman, and we can help maybe potentially lower their risk through medications or improved screening now with MRIs. Speaking of screening, it's an opportunity again to put a plug in that screening does save lives, and we have found that through mammograms in women over the age of 40, we can certainly help catch cancers early, help women survive these cancers, where years ago many of them would not have been as fortunate. So a woman over the age of 40 ought to get her mammogram and then performed annually thereafter. So if any of you all out there fit in that category and have not had your mammogram this year, when you're done dancing, go get yourself signed up for a mammogram. We really have a wonderful program here in the upstate with Gibbs and with the Beard and Josie Breast Center that is truly, I think, a jewel. There's many communities would love to have the facility and the care that's provided here, and I think we are blessed to have it, and so are the women in the upstate. Despite the availability of mammographic screening, there are still many women who get diagnosed, unfortunately, with advanced stages. And whereas years ago that might have meant a death sentence, we have improved drugs that are really helping allow women to have an opportunity to live for full and lengthy lives with the advent of medications like trastuzumab, pertuzumab, which are specialized drugs for breast cancers that have a specific growth pattern that's driven by a receptor called HER2. So the dollars that you all are raising tonight and that others have helped fund research for over the years is paying off with amazing drugs that are really making a difference in these women's lives.
Hi, I'm Dr. Amy Curtis, and I'm a radiation oncologist here at Gibbs Cancer Center, and I want to thank you all for your support. The work we do here is vitally important to each patient that walks through these doors, and I can tell you I see patients from all walks of life. People who've made choices who probably figured sooner or later they would end up here, and people whose cancer diagnosis took them completely off guard. Thank you so much for supporting our mission here to make sure that all of these patients receive the best possible care. I also want to talk for a few minutes about those choices that hopefully can prevent you from walking through this door. You all are at an age in your life where you have so many options about how to spend your time, and I hope that you'll spend it being active. Obesity is growing as a leading indicator for preventable disease, including cancer. And of course, we all know that quitting smoking or not smoking at all is another important way to prevent cancer. I hope you all have fun tonight, and thank you again.
My name is Dan Freed. I'm a radiation oncologist at Gibbs Cancer Center. My background is actually I have a PhD in epidemiology and an MD, and had done a lot of research before coming to Gibbs. I was on the faculty at Wake Forest University as a radiation oncologist for 4 years, and then came here. Gibbs Cancer Center is really unlike most other community cancer centers you might see around the country. There's a lot more research going on here even than there is at a lot of larger cancer centers. We put a lot of emphasis also on patient care, multidisciplinary patient care, trying to make sure that we have the most cutting-edge treatment options for all of our patients, but also to make sure that we stay in touch with our patients. It's a much kind of kinder, gentler place than a lot of big cancer centers like the one that I had trained at and the one that I was at before I came here. What I do is radiation oncology, so I treat primarily prostate cancer, breast cancer, and lung cancer. I also do something called stereotactic body radiotherapy and stereotactic radiosurgery, which is the treatment of relatively small tumors with very high doses of radiation just for a couple or a few treatments. Some things to know about the Gibbs Cancer Center. First of all, that we are a very research-oriented cancer center, and that we in fact enroll more patients or a higher percentage of patients to clinical trials than is average for even comprehensive cancer centers that are attached to big academic institutions, and that we enroll about 4 times as many patients on average compared to other community cancer centers. So there's a lot going on here with regard to research, but we never lose sight of the fact that really our emphasis needs to be on patient care.
Hello, my name is Asha Desai. I am from India and I came in 1983 to US. I started working at Spartanburg Regional in 1986. So I'm here about 26 years. I have worked in the Gibbs Infusion Center about 13 years, and I love my job. I love to help patients, and our Gibbs Infusion Center is such a facility that gives patients not only treatment, but all kind of moral support and some hugs and kisses that helps patients with lots of life-threatening situations that they are in. We try to help them as much as we can, and my main job is to admit the patients in the computer system for our flow to go through smoothly. Gibbs Infusion Center is such a facility that has helped so many patients, and our patients always love to come and see us as often as they can because they love us and we help them tremendously. I'm so proud of my job and so proud of Gibbs Infusion Center that I can always refer anybody who needs help with treatment can come to Gibbs Infusion Center, and we can help them that they will remember rest of their life.
My name is Dr. Drew Menito. I'm a radiation oncologist at Gibbs Regional Cancer Center. I've been here since 1998, and it's been a pleasure to watch the Gibbs Cancer Center develop into the institution that it is today. We have a beautiful and wonderful cancer center, but really the best thing about our cancer center is the focus on the patient, their quality of life, and the quality of their cancer care. We've now gotten to the point where we have specific meetings that we call multidisciplinary conferences, where all of the specialists who are taking care of a patient with a particular cancer are in the same room together discussing and planning that patient's treatments as a collaboration. And we've seen this develop into wonderful results, and patients are given the best options, and through collaboration of their physicians really get the best results in terms of their cancer care. We are also very proud that we have a wonderful staff and support services here at the hospital at Gibbs Regional Cancer Center, and frequently get compliments from patients who, of course, never want to go through a cancer treatment experience, but when they come out the other end of it, we often get compliments about how caring the staff was, and that's really why we're here. So when we get feedback back like that, it makes everything worthwhile for us. The Gibbs is also a big believer in cancer screening, which we believe is important for most of the major types of cancer, for breast cancer, prostate cancer, lung cancer, colorectal cancer, and we encourage the community to participate in screening on an individual basis by providing educational lectures about the importance of screening, but also some free screening opportunities for the community. We know with almost every cancer, to catch it early gives us the best chance of curing the cancer.